Hello everyone, Dr. Carlos Rainha from Smart Slim Clinic here, and we're always start saying the beauty matters, and we're gonna talk some the subject of some part of your face, which is give us more definition to your face, and explain this because we're gonna talk about your chin, right? Your chin is right where people not much look at it, because you're gonna catch that area if you're looking yourself on the peripheral. Sometimes looking in people's face, look at front, it doesn't look at the problem you may have, right? After we talk about this, you might gonna see where we're going, right? So here is a typical example, right? We have inward, the chin part of your face, and which is the jaw area, or the area which you need more definition. And a lot of people sometimes they might come to us and say their nose is bigger and they don't like their nose. But the reality sometimes it's not a nose problem, that's your chin problem. Okay, so that needs to be done. And two ways we do this, one is do the implant, and another way we do is called implant but transfer fat tissue. Now again, it depends how much the difference between these angles we have, because you see the nose has to come align all the way here and kind of match pretty much there. So that difference there, if it's too much difference, the recommendation here would be you do a prosthesis or an implant, not a fat implant, right? But we call fat transfer, and we get a fat from somewhere from your body and add it to the area. Also, we can do it with the hyaluronic acid added to the area, and it makes it a little more like this, because you see the nose now is come all the way here, is the difference is not big there anymore, and it gives you a better perfume and a better looking good face, right? So you can see this lady here, and the nose was not done anything, it's dripping, but you can see her chin is all the way inward there, and here is more outward, right? And so how do we do this? It again we do with the prosthesis, is an implant now we do, and they can go in two ways. And we go through inside your mouth, oral cavity, and it go under your lips and put your prosthesis there, or we can go subdermal here, and we call it periosteal, right? But it's going above your bone, and you can see this photo here. We open a dermal incision, and then place the prosthesis, and which is a silicone. It's similar to other prosthesis that is being used in the market, right? And that's a soft, and it gives that projection, because what happening here, you see in this case here, she doesn't have much projection, and here now she does, right? So, and you see the improvement in her face, and obviously she did her nose also, which give you better projection, and it's really, there is quite a bit of change on the people's face when you look at that aspect. And again, sometimes people come because they worry about the nose, but the problem you may have is just the chin, and we can add the fat tissue from a transfer from your own fat, or we can do a prosthesis implant, which is give that projection enough to change your face. You can see a photo here, and again it's slightly changed you know, you see there, and after they put the prosthesis there, and you can see the change in the face there. It does change your face, and looking your face as a whole and as symmetric, and so it again right and left. And when you look, the person looking to the front side or peripheral side, and you can see always there is some difference there. But we're here for it, right? So a consultation, and we do an assessment, and we'll be more glad to help you, you know, to do those change. So we gonna say goodbye for this 5 minutes we had, but you know, you can always ask us a question, text us or call us, and you can come over for assessment, and we'll be more glad to help you. We'll see you next video. Hopefully you follow us on Facebook, on YouTube, and we're always gonna have some 5 minutes to give some tips for you. We'll see you later then, and the next you know, video to be recorded.